大石実の英語英会話2
Lesson 10 myasthenia gravis Skit 1
Miss White, please come in.
Good morning. May I sit here?
Sure. I'm Dr. Oishi. What is the matter with you?
My muscles have become weak.
When did this start?
About 3 months ago, I noticed a slight weakness in all my extremities.
Did it start suddenly or gradually?
Gradually. The weakness was mild at first, but recently I can't even play tennis.
Do you have any other symptoms?
I developed double vision a few days ago.
Are your symptoms worse in the evening than in the morning?
Yes. I feel weak, especially after I work hard.
Let me examine you briefly. Follow my finger with your eyes. Do you see it double?
Yes. When I look to the left and upwards, I see it double.
Please keep looking upwards for a while.
Okay. I'm trying to keep looking upwards, but my eyelids droop gradually no matter what I do.
I want to examine your muscle strength. Bend your arm and don't let me pull it.
I'm doing my best, but I can't resist you.
Please lie on the bed. I'm going to give you an injection and then test your muscle strength again. Nurse, prepare a tensilon test.
Is this test very painful?
Not much. Now, I have injected some medicine. Let me check your muscle strength.
Wait a minute, Doctor. I'm dizzy now.
Let me check your pulse. You have bradycardia. This is a side effect of the medicine. I'll give you an injection of atropine sulfate.
I feel a little better now.
I think you probably have myasthenia gravis. In order to confirm the diagnosis, I want you to have 3 more tests. That is, blood tests, a CT scan of the chest, and an EMG.
Can I have these tests today?
No, blood tests can be done today, but you have to get appointments for the CT scan and EMG.
Where can I get the appointments?
You have to go to the radiology department to get an appointment for the CT scan.
How about the EMG?
I'll give you an appointment for the EMG now. Can you come tomorrow afternoon?
That's fine with me.
Please take these slips to the laboratory for blood tests.
When should I return to find out about the tests?
Come back to this clinic in 2 weeks. The results of the tests will be ready by then.
Skit 2
Good afternoon, Miss White.
Good afternoon, Dr. Oishi.
Today I'll perform a repetitive nerve stimulation test and a single-fiber electromyography. These tests are a little painful, but they're not dangerous. Please lie on this bed.
How long will it take to do these tests?
About 2 hours. Now, I'll give you electrical stimuli at your wrist.
Oh, my thumb twitches.
Don't worry. Now, I've finished the repetitive nerve stimulation test. It wasn't bad, was it?
No, it wasn't as bad as I expected.
Now I'll do a single-fiber EMG. In this examination, I'll put a small needle in your muscle.
Which is more painful, a repetitive nerve stimulation test or a single-fiber EMG?
It depends on the individual. Generally speaking, single-fiber EMGs take more time and are a little more painful.
Okay, go ahead.
Keep your middle finger up during the examination.
It hurts.
I know, but this test is very important to find out whether you have myasthenia gravis or not.
Did you find any abnormality in the previous examination?
It showed a slight waning phenomenon at 3 Hertz stimulation, but the decrease in amplitude is not big enough to make a diagnosis of myasthenia gravis.
How about this test?
I have to calculate later, but so far it seems that you have an increased jitter, which suggests myasthenia gravis.
Is there any good medicine for myasthenia gravis?
Yes, I'll prescribe Mestinon. Take 1 tablet 3 times a day.
Skit 3
Hi, Jane. How are you today?
Fine, thank you. My muscle power has been stronger since you gave me the Mestinon.
Have you had any abdominal pain or diarrhea?
No.
Let me check the results of the blood tests. Well, the blood tests are normal, except for the anti-acetylcholine receptor antibodies.
What does that mean?
The presence of anti-acetylcholine receptor antibodies suggests myasthenia gravis.
Is there any abnormality in the CT scan of my chest?
I have the CT scan here. See, you have an abnormally enlarged thymus.
Does it mean a tumor of the thymus?
It's difficult to differentiate thymoma from hyperplasia of the thymus.
Well, I'm sorry, I don't understand that. I'd just like to know if it might be a malignant tumor.
Malignant thymoma is very rare, and the most frequent abnormality accompanying myasthenia gravis is hyperplasia of the thymus. So I'd say this might mean hyperplasia rather than a tumor.
Do I need an operation?
Yes, I recommend a thymectomy.
Is the operation urgent?
No, you have time to talk with your family.
How long would I have to stay in the hospital?
The average length of stay for a thymectomy is about 3 weeks.